Hi everybody, Crystal here at the Fibromyalgia Pain Chronicles, coming to you with my Fibro in 5, episode 5, in which I break down different topics in relation to fibromyalgia in 5 minutes or less. Today's topic is the most common secondary medical conditions people with fibromyalgia often develop as a result of having fibro. With that said, this list is not exhaustive. It's just the ones that seem to be the most common amongst the fibromyalgia community. While researchers do not fully understand fibromyalgia, much less why we develop so many other medical conditions as a result, they do know that fibromyalgia is a central nervous system disorder and that it does interfere with our internal bodily systems, which is seemingly two reasons why we are at higher risk of developing other medical conditions. With that said, some of those medical conditions are IBS, or irritable bowel syndrome, migraines and cluster headaches, costochondritis, that is actually where the cartilage between your ribs and your rib cage gets inflamed. Raynaud syndrome, which is a circulatory issue and typically seen mostly in our hands and feet, where we lose the sensation of feeling, our digits become extremely cold. Another common condition that we often develop and are diagnosed with is chronic fatigue syndrome, and also adding an extra layer of insomnia in there because, can't have one without the other, right? Syncope, which is actually vertigo, dizziness, and sometimes even fainting. So this one, I'm probably going to butcher it because I am no medical expert, but it's called interstitial cystitis. And this is actually often referred to as IC. And this is a condition that is also commonly called bladder pain syndrome, and it is a medical condition that affects the bladder, and they have found, like, in individuals with fibromyalgia that develop IC, that the main nerve in the bladder seems to be inflamed and damaged, and I think this is why people with fibromyalgia often develop IC as a result. And the symptoms of that is basically your bladder hurts. You can have issues going to the bathroom, pelvic pain, nausea. So research has indicated approximately like 26 or 27% of people with fibromyalgia end up developing IC. Another one that is often missed, but not, it's actually fairly common with people with fibromyalgia, is tachycardia, arrhythmia, and high blood pressure. So with high blood pressure, they do know that people with fibromyalgia or individuals that suffer from chronic pain, this actually causes your blood pressure to go up. And it is theorized this is why we often find people that suffer from chronic pain have high blood pressure levels, especially when they're in flare-ups. So it's something to watch and keep an eye on. I recommend people journal their blood pressure rates, like when they're on low pain days, high pain days, so that they can see the difference. I know when I'm in flare-ups or in high pain, my blood pressure is like super high. And then tachycardia and arrhythmia, again, it's seen often in people with fibromyalgia. While medical experts and researchers don't fully understand, they do think that it might be in relation to the central nervous system, since fibromyalgia is classified as a central nervous system disorder, and some theories are that the messages going to our heart are getting messed up or not correct, and then that can lead to tachycardia or arrhythmia. So that's one theory on that. So these are just, like I said earlier in the video, some of the more common secondary medical conditions. There's a lot of secondary medical conditions people with fibromyalgia develop. These are just some of the more common ones. And then obviously when you have fibromyalgia, you are contending with those symptoms in related to fibromyalgia. And then for every secondary medical condition a person with fibromyalgia develops, then they're dealing with all of those symptoms. So imagine having fibromyalgia where you're in chronic pain, muscular rheumatism, which is the muscle knots, muscle stiffness, muscle spasms, dealing with brain fog and nausea, and then add in IBS, add in migraines, costochondritis, Raynaud's syndrome, chronic fatigue syndrome, and then next thing you know, poof, it's like you're contending with a ton of symptoms, like 100 or so. The most important thing though is to educate yourself on fibromyalgia, what it is, the common symptoms, and then educate yourself on the secondary medical conditions that you have and its symptoms, so that when you're having flare-ups, whether it's fibromyalgia or one of the common secondary medical conditions, you can at least identify it so that you'll know what you need when you speak with your medical health provider as far as support and treatment to address the symptoms that are specific to the flare-up you're experiencing with the said medical condition. If that makes sense. That's a mouthful. So there you have it. Those are some of the common secondary medical conditions people with fibromyalgia often develop. As I said, this is not an exhaustive list. Of course, there's others, and then everybody with fibro is different. Thus, we all have a slightly different take or how fibromyalgia affects each and every one of us. So this is just a guideline or an outline of information, and it is not set in stone. So if you found this video helpful, please like and share to help spread awareness of fibromyalgia. Thank you.